Hello, my name is Dr. Nicholas Cohen, and I'm here to share with you a top 10 list of tips for children who wet their beds. Tip number 1 is know when to recognize that bedwetting is a problem. Bedwetting can be considered a problem when a child turns 5 and is still wetting their bed. However, 15% of children at age 5 continue to wet their beds. So understand that the problem is very common at that age. Tip number 2 is if you are concerned about your child's bedwetting, then see a doctor. Your doctor will do a complete history, physical, and usually a urinalysis. There are many causes for bedwetting, and your doctor will make sure that all of the that the medical causes for bedwetting are ruled out. This will include asking about constipation, assessing for the possibility of diabetes, a urinary tract infection, pinworms, kidney failure, seizures, and sleep apnea. All of these medical diagnoses can lead to bedwetting. So your doctor will make sure that your child does not have any of these medical diagnoses. Another major cause of bedwetting is emotional disturbances in the house. So this will also be assessed during your child's evaluation. Tip number 3, once you've seen a doctor and embark on a plan, it's important to keep a diary. The diary can be a 24-hour account of all of the fluids that your child takes in and the amount and the time of day, as well as all of the times your child urinates, as well as approximate amounts of urine throughout the day. Tip number along with the diary would be a calendar where all of your child's wet nights and dry nights are recorded so that the effect of any interventions can be assessed. Furthermore, it's important to, so tip number 3 is keeping a diary and keeping a calendar. Tip number 4 is regular voiding. Your child should attempt to urinate regularly throughout the day and just before going to bed. Your child should urinate about 4 to 7 times at least a day in order to, as a step to make sure that your child is doing all he or she can during the day to avoid bedwetting at night. Tip number 5, avoid high sugar and caffeinated drinks, especially towards bedtime. Tip number 6 is concentrate fluid intake in the morning and the afternoon so that your child is not drinking a lot of fluids towards bedtime. Tip number 7 is an award system. So have some form of award for your child when she or he is able to go the night without wetting their bed. One example would be a star system where your child gets a star every night that he or she makes it through the night without wetting his or her bed. And then if there are 7 consecutive stars or 7 consecutive nights without wetting your child's bed, your child gets a book. There are many examples of reward systems, but this is a useful and productive one. Tip number 8 is Enuresis alarms. Enuresis means just going to urinating at night. And these alarms go off when your child urinates in her bed. So they can be purchased online, and the alarms will either make a sound, a light, or a vibration when it senses moisture in your child's underpants. When the alarm goes off, your child should be instructed on how to leave the bed, go to the bathroom, urinate, and come back. These Enuresis alarms are the most effective way to reduce bedwetting, but it's important to do all the other behavioral steps that I've described above as well. Tip number 9 is desmopressin. Desmopressin is a medication that can be prescribed to help your child if they're having problems with bedwetting. And it's an alternative to an Enuresis alarm or in cases where the alarm has failed. And tip number 10, believe in yourself. Bedwetting is a very common problem in children, especially around age 5 and it's a problem that has pretty easy and effective solutions. So I hope these tips have been helpful. Thank you very much for listening, and have a great day.